Hello everyone. In this video we study about pituitary adenoma. Pituitary adenoma is a benign tumor of anterior pituitary cells. Here are five cells present in anterior pituitary. What are those? These are lectotrophs, thyrotrophs, somatotrophs, and gonadotrophs and corticotrophs. Each cell produces its specific hormone. As we know its physiology, we discussed it in previous video. Lectotrophs produce prolactin. The thyrotrophs produce thyroid stimulating hormone, somatotrophs produce growth hormone, and gonadotrophs produce luteinizing hormone and follicle stimulating hormone, and corticotrophs produce adrenocorticotropin hormone. These are five cells produce five or six hormone in our blood. For a general view, if a tumor occur in these cells, then what will happen? If a tumor occur of the lectotrophs, then what happen? Prolactin will start producing, and prolactin level will increase in our blood. Then symptoms will appear, increased level of prolactin. This is a general view. Then we study what is the cause of pituitary adenoma. There are no exact cause we know about pituitary adenoma. What we know that it may be a genetic mutation. Genetic mutation in tumor suppressor gene, those genes which suppress tumor in our body. Then maybe there will have radiation exposure in the past. Then maybe it's a family history. The patient family, their tumor present. These are some causes or risk factors which we know about pituitary adenoma, but exact cause we don't know. Then according to pituitary adenoma, we classify it into two types. One type is non-functional tumor, then one type is functional tumor. What does it mean? Non-functional mean the tumor is not producing its hormone. Functional mean tumor producing its hormone. For example, if a tumor of lectotrophs occur but it produce prolactin also, then it will functional tumor. If a tumor of lectotroph occur but it not produce prolactin hormone in our body, then this tumor will be non-functional tumor. Then first we study about non-functional tumor. Then we study about functional tumor. Non-functional tumor is those tumor which don't produce their hormone in our body. Then symptoms will appear due to mass effect. What is mass effect? As we know, if a tumor occur in our anterior pituitary, then what will happen? This will which come out as a mass in our pituitary. This mass will show specific symptoms. Only this mass shows some specific symptoms in this patient which have non-functional tumor. Which symptoms will appear? There are three most common symptoms appear in this patient. First of all, the headache. As a mass present in our brain cells, what will happen? This mass will irritate our nerve cells, blood vessels. Due to irritation of nerve cells and blood vessels, there will production of headache will occur, and patient present with a severe headache due to irritation. Then second most common symptoms will appear in non-functional tumor. This bitemporal hemianopia. What is bitemporal hemianopia? This is side vision loss. Temporal field vision loss. What is this? Bitemporal hemianopia is patient will appear of temporal side vision loss. How? Here is our visual field. I draw it here. There are two visual field present. One is from nasal side, which is medial to nasal, and one is from temporal side. From nasal side, optic nerve go directly on its own side, go into occipital lobe by optic tract. From temporal side, optic nerve cross from a specific point and go into for example, if from left temporal field optic nerve come, this will go into right optic tract. If from right temporal lobe, if from right temporal field optic nerve arise, this will go into left optic tract and go into occipital lobe. And these cross sections occur at a specific point which we call optic chiasm. This optic chiasm present at the upper side of pituitary gland, and when this mass disturb it, when this mass compress it, when this mass damage it, this will come out as this will damage our optic nerve which cross from temporal side. If it's damaged temporal side optic nerve, optic pathway, then what happen? Then temporal side vision will not go into occipital lobe. If temporal side vision not go into occipital lobe, then what happen? Then patient don't look from temporal side. and this will come out side via loss and temporal via node, which we call bitemporal hemianopia. This is an important feature of non-functional tumor of pituitary adenoma. Then third most common symptom will appear is hypopituitarism due to compression of normal cells. Normal cell compression. What happened? These cells start losing their function and come out as hypopituitarism. These are the specific symptoms which with non-functional tumor. Then we have some functional tumor. Functional tumor, most common functional tumor are growth hormone cell adenoma and prolactinoma. What is growth hormone cell adenoma? As we discussed earlier, there are 5 cells present. As we discussed earlier, if a bright proliferation of somatotrophs occur, what will happen? There will increase production of growth hormone. What will be features? Here look, if a tumor of growth hormone cells occur, what will happen? Increased level of growth hormone will produce in our body. When growth hormone level increase, there will increase function of growth hormone. What is the function of growth hormone? Growth hormone function is increase growth of body. Then what happened? This patient present with increased growth of body. If a child present, this child will present as gigantism. What is gigantism? Gigantism is a patient will have increased linear body mass. In a childhood, when growth period not close, what happened? Length of our bone will start increasing. When length of our bone start increasing, this child will increase in length, which will come out as tall height. This child will have tall height. After puberty, what will happen? Growth hormone persistently releasing from anterior pituitary without any suppression. What will happen? This will do increase growth of body persistently. Then now growth plate are closed. Now growth plate are closed. When growth plate are closed, there will not increase linear growth. There will not grow in linear growth, but there will increase in width of bone. There will increase width of bone and thickness of bone, which will come out as acromegaly. Then this patient present with long hand and long legs and increase thickness of bone of their jaw and feet also occur in this patient. This is called acromegaly. Then this patient may also present with secondary diabetes mellitus. How? As we know, as we discussed in earlier video, the growth hormone increase glucose level in our body by increasing gluconeogenesis, by lipolysis and by glycogenolysis, and by different ways it increase glucose level in our body. When glucose level persistently increase our body, this will come out as secondary diabetes mellitus. Okay, then these most 3 common symptoms will appear in growth hormone cell adenoma. Then if we do diagnosis of this patient, we will see, if we check blood of this patient, there will increase growth hormone, increase insulin like growth factor which produced by growth hormone. They will increase, and there will lack of suppression of growth hormone. For suppression of growth hormone, we do a test, oral glucose test. What we do? We give a oral glucose to a patient, and then we check growth hormone in patient. In this patient, when we give oral glucose and after when we check, there will no suppression of growth hormone. Normally, growth hormone suppressed by hyperglycemia. When hyperglycemia occurs in our body, growth hormone suppressed. But in this condition, growth hormone not suppressed, and persistently growth hormone start increasing